So I can quote a randomized controlled trial, which is the gold standard that the Ivory Tower used. So they did a simple intervention, 3 things to see what would happen to the risk of cancer. And so it was vitamin D, omega-3 fatty acids, plus an exercise program. And they showed the combination of all 3 reduced the risk of cancer by 60%. 60%. So those are very simple things that people can do. So it's a matter of exercising, taking vitamin D, and modifying your diet can significantly reduce your risk of getting cancer.
I'm just going to repeat that for a second. You're saying a combination of vitamin D, omega-3 fatty acids, and exercise reduced cancer risk by 60%?
That's correct.
Wow.
Yes, so that doesn't get a lot of press because you can't make money. In fact, it's counterproductive for the pharmaceutical industry and the medical complex if people don't get cancer. And so, this was published in a peer-reviewed paper, in a peer-reviewed journal. It's a really good study. It's supported by other studies. There are many studies that show that exercise reduces your risk of cancer. There's data that shows that simple relaxation techniques and techniques in terms of meditation, yoga, relaxation techniques improve your outcome if you get cancer. So there are some very simple lifestyle interventions that can reduce both your risk of getting cancer, and if you have cancer, can improve the outcome.
Well, I'm just going to comment on this. Given how prevalent cancer is in our society, I mean, the risk of cancer, and you outlined this a little bit earlier, is high for every person. If you can reduce that by 60%, I mean, we should all be rushing off and starting this regimen, never mind other things you're going to tell us about in a moment.
Yeah, so it doesn't get the attention that it should get. I mean, particularly vitamin D. The data on vitamin D in preventing cancer, in preventing Alzheimer's disease, in preventing depression is overwhelming. And it's safe, it's a cheap intervention that has minimal adverse events. And so from my perspective, there's no reason that everybody should not be taking vitamin D.